Alberta's failed Dynalife deal cost taxpayers $125 million, with no added value on top of disrupted services and further impacts to patients and staff. These are all the findings of an Auditor General report made about the privatized contract by the UCP government in 2022.
The government's own procurement processes were not followed. And these are the very processes that are designed to protect Albertans' interests.
Alberta Health Services signed the $4.6 billion contract with Dynalife as a way to outsource lab services. But the report notes AHS and Alberta Health had multiple failures during the search and execution of the contract. Wiley says AHS followed through with procurement despite knowing it wouldn't save any money and did not look into Dynalife's financial proposals. The 7 months of Dynalife running lab services was plagued with long wait times, lack of appointments, and an above-average number of errors, with results compromising patients. By September 2023, the contract was terminated and AHS resumed control under Alberta Precision Laboratories. It's important to note this work was done during the UCP's first term under former Premier Jason Kenney and Health Ministers Tyler Shandro and Jason Copping, who are all out of public life.
It was often difficult to determine who was making the decisions because we identified instances where there was really a lack of documentation of who was making some of the decisions.
The report also notes AHS staff felt discouraged from voicing concerns with Alberta Health due to fear of repercussions. Wiley's investigation was also hampered with not getting all necessary documents or ones heavily redacted. In an unattributed statement from the Ministry of Primary and Preventative Health Services, it says, in part, immediately following the election and the appointment of Minister Adriana LaGrange as Minister of Health, Premier Smith and the minister identified Dynalife's inability to provide adequate service for Albertans. In June of 2023, we directed the agreement with Dynalife be terminated and shifted services to Alberta Precision Labs.
This was a terrible experiment driven by ideology. The government wanted privatization no matter what. The AG report shows that they cared more about moving on privatization, even though they only had one bidder, and it was clear that it wasn't going to save money. The UCP forged ahead.
Now, 2 recommendations have been made, including the now 2 health ministries ensure procurement processes and reporting are followed, as well ensuring records of key decisions and directions, including who made them and why, are kept. In Edmonton, James Dunn, City News.